Good afternoon, ladies and gentlemen. As you can see, I have identified myself here as an Iraqi physician because I'm, at the moment, at the next 10 minutes, I'm not wearing my WHO hat. Next, please. Thank you. So, when we talk about conflict in Iraq, we want to talk about, first, can I go to the previous slide, please? Thank you. Yes, which conflict? Because Iraq has been going through conflicts over the past, God knows how many years. We started with the Iraq-Iran war, and then there was the invasion and liberation of Kuwait, 1990 to 1991, and then there were the sanctions, the international sanctions on Iraq between 1990 and 2003, and then there was the April 2003 war on Iraq, the invasion, and then there was the internal conflict thereafter, and which is continuing until the moment. Now, how did this impact on the health of the people of Iraq? It did impact in two ways, actually, mostly directly, but also indirectly. And when we talk about the direct impact, immediately after the war, there was this debate between decision makers on whether we need to build back the system based on what used to be the system, or to start all over again. And this was a very long dialogue, unresolved, unfortunately. I keep saying that when a change happens in a country, there is no country that should start from zero. There is always a history and a wealth of experience which one has to build on, and not to start from scratch. Now, it impacted also on health services. There was, after 2003, a decrease in service coverage rates. There were geographic inequalities between areas that were safe and secure, and between areas which were what they call the hot areas, where conflict was going on. There was an inequality in the workload between different facilities. People opted for facilities which were more accessible than those who are located in hot areas. Health facilities located in areas where IDPs have fled to. So even those who were previously not overloaded, now they are overloaded with more population that had changed locations. There were services that were provided by newly opened NGOs that arrived into the country after the war, and these implemented different practices, and they had limited resources and worked for limited durations. So they had actually paralleled the existing system rather than adding up to it. And then service providers were overloaded by casualties. To date, we are having incidents, explosions, which result in so many casualties, and they really overburden the service. And then there was the destruction and looting of health facilities, and that was particularly in April 2003, where public health labs, quality control labs, warehouses, and other health facilities, blood banks, were attacked and destroyed, and the service to the people were affected. Now, what happened to the human resources? Human resources started, and the good ones and the experienced ones, started to leave the country with the 90s because of economic hardships, and of course also because of violence and because of political changes. Those who took over, of course, were of lesser quality, and that impacted on the service. Many of the good doctors and hardworking ones actually had lost their lives in the violence. And there was a skill deterioration because of lack of training or bad quality of training. Many good ones were also recruited by aid agencies, so that was an internal brain drain, or by the private sector. And again, salaries were very low, and the health workers were demoralized. You will notice that in brackets is the period when this happened more, so the yellow brackets, please, next. Okay. Healthcare financing. What percentage of the national budget went to health? Actually, very little, especially since the 1980s, because so much of it was shifted to the warfare. And then during the sanctions, there was already shortages in every item of the budget, and health suffered most. The ministry, after the conflict, after the invasion in 2003, Ministry of Health employed all health workers working in the military, and that had really increased the salary bill very much. How much was allocated to reconstruction and construction of health facilities? Practically none since 1990. And before 1990, of course, the main source was for the health services, the main source of finance was the public, but later on it relied very much on assistance and on self-financing next case. Management also suffered because experienced managers had left the country starting, as I mentioned, 1991, and this impacted on everything relevant to management: human resource management, information management, asset management, personnel management, supply management, and others. I have to rush, I have very limited time. And then health information. There used to be a good health information system inside Iraq. Yes, old, yes, maybe not very well integrated, but there was a system. Now this system was severely affected by the 2003 events, and the data was lost because of the looting of the equipment, because of not enough backups. And there came the flood of assessments, one assessment after the other, after the other. Unfortunately, not so much of the results of these assessments were used to assist and to aid decision-making in the country. So they were assessments for the sake of assessments. Pharmaceuticals. Before and since the 1970s, there was one state company which had run the whole show. And one state company means, as you know, corruption. And that was really and still is a corrupt institution. There was inadequate financing, especially during the economic sanctions of 1990 to 2003, and there was shortages in so many items, so many drug items. There was weak capacity in estimating requirements and in putting together the national drug list that is needed for the country. There was also a collapse of the National Drug Quality Control Lab and loss of good capacity there. And of course, the electronic drug management system, which was used prior to 2003 during the oil for food and medicines, was stopped after 2003. And then came the drug donations, which were mostly not relevant to the needs in the country. Next, please. How did that affect it indirectly? How did it affect health indirectly? Through affecting social determinants of health. So these conflicts have their effect on livelihoods, on education, on weakness of other sectors like the water, sanitation, nutrition, energy, infrastructure. And there was, of course, after 2003, deteriorating security, which affected access to healthcare. And then there was always a reduced government expenditure on health. Were there benefits? Yes. Exposure of Iraqi after the 2003 invasion, there was an exposure of Iraqi professionals to the international experience, of which they were deprived for so many years, more than 3 decades. So they were able to travel and to train outside the country. They also entered the digital era, which they were not capable of doing. We had no connection to the internet before 2003. It was really, really limited. And then their salaries increased markedly. Iraqi doctors now, because of these conflicts, they have the best experience in traumatology all over the world. They have to deal with it every day. And they are now learning the meaning of democracy and freedom. But however, the price was very high because we paid with blood. Thank you.